My name is Charlene Mullaney. I'm the Clinical Care Coordinator for the medical units at the Yorkton Regional Health Centre. I was a staff member on this floor for 15 years before I went into the Clinical Care Coordinator position, so I'm aware of the challenges and the struggles that they face and how some of the changes we've made are going to impact them as a ward, how they'll improve them, how at first they may be a little bit frustrating, but over time we adapt because change is difficult for people. And we need to take our time and encourage the change, and we know that there's going to be ups and downs, and we have to have patience with that. The purpose of the ward meetings is to encourage staff to continue to participate. It shows them the progress that we've made and the changes that we've made in our ward routines, and it shows them how we've done with our statistics as far as falls prevention, patient satisfaction, staff satisfaction, and it keeps them focused on what needs to be done and how we can continue to improve our ward. It shows them that there is progress being made, that all the hard work that they're doing is beneficial and that we are seeing results of it. I'd like to thank everyone for attending this afternoon's board meeting. I'd like to thank Roberta for coming. She's our executive lead for RTC, Diane, also an RTC lead, and Cheryl Fox, our Director of Patient Safety and Improvement, PSI for coming to our meeting today. Lenore is going to talk to you about our Knowing How We're Doing segment.
Okay, so we'll just look at the board here. I'll just kind of go over the things that we're measuring and where we're at with stuff. The patient satisfaction, again, we look really good right now for the last couple of surveys. Patient falls, we had a spectacular month in July, no falls at all. Right now we're looking at one fall for August, and so that's looking good, not for the person who fell, but for everybody else. The thing to remember though is we have half the patients right now for the last couple of months, so we need to keep that in mind when we're looking at those July and August numbers as well. But we're definitely going in the direction we want to go there.
Ward meetings are held on a regular basis. We meet every Wednesday at 13:45 in front of the board, and that way staff knows that it's consistent and that they know what to expect and when to be there.
Staff satisfaction.
The process for organizing a meeting is determining what has taken place in the last week or so, where we want to go in the future, and it helps us by developing a plan and moving forward. We will bring run charts, any new documents that we're going to be drafting and bringing to the staff. Right now we've added an audit sheet to the board so that people can see what the audits are going to be about. We post pictures on there of before and after shots of some of the work that we've done. We do encourage staff participation though. We've had different staff members lead the board meetings.
Is there any questions or anything about the things that we're measuring, or what's going on there? Or how are you guys feeling about Xero Falls for July? Yay! Yeah, I was very excited to see that.
Yeah, that is a major thing, having no falls. We did have a couple of months that didn't look so good, but we were also extremely overbedded at that time, and we had increased equipment and people in rooms, and it makes mobility difficult. So this is a drastic improvement. It's very good to see.
So I was going to say general thoughts when you look at that number has been going down over the last few months. I think Lenore, you mentioned a couple of potential reasons. Just any other thoughts as to why? There's other initiatives I know you're working on simultaneously on the unit. Do you think that's having an impact, or
in terms of the intentional rounding piece, is that? I mean, again, with new staff and stuff like that, is that is that happening? Do you think that's contributing to the decrease in the number of falls over the last few months?
Some of the communication skills that would be effective for a board meeting would be sense of humor and self-confidence and being prepared, knowing what you want to talk about, just being open to suggestions and criticisms, because you never really know what response you're going to get to some of your new ideas. So you need to be very open and responsive to things. We've changed and cleaned things up, and as a result of that, I'm going to increase someone's job by getting them to do a audit of these areas. We're going to fill out these target condition sheets. We'll have a picture of what the room is supposed to look like and a picture of what the room is not supposed to look like. I'd like everyone, when you have a minute, to stop by here and write on here what you want to see in place, what would show you that things aren't in place. Example, in the hallway, the linen cart's not where they're supposed to be. Audits are very simple. All I want is a yes or no. Is the area looking the way it's supposed to? Who audited it, and the comments. If the answer is no, then I want to know what's been on the floor or what is out of place. And then we will bring these audits to our board meeting every Wednesday, and we can go over them and try to correct the errors that we've made.
We need some volunteers, I guess, to take some photos for our audit, for the 6 places that we're going to be auditing, for what it should look like and what it should not look like. So does anybody want to volunteer? Camera happy?
I'll supply the camera. There you go. All right, good. 2 volunteers. That's one job that's out of the way. There you go. Thanks for volunteering. Let me know when you have them. I'll take them and develop them. Okay. And we'll do these up and we'll post them in all the areas that need to be audited.
We tried to make a few notes of what we want and what we don't want these places to look like in the audit. So I'm just going to put all staff to do that over the next couple of weeks, and then we'll be able to get this typed up with the photos on, and we can start doing the audits. So is that good to go? Mm-hmm. Okay, cool. All right. So I'll put this up here just to remind us.
Honey-do list.
Yes.
Okay. And also with RTC, we have drafted a discharge planning tool that we hope to use with our PSAG board. Some of our physicians have asked that we incorporate this into our charts, that all the disciplines can write on it. Physio, dietary, OT, PT, palliative care, home care, pharmacy, all the different disciplines that normally attend a ward round meeting will have access to this form. When the patient is ready for discharge, we will have all the information at a glance. We will be able to easily and hopefully more quickly discharge our patients.
Is it going to replace the form that we're already using?
Yes, it will. It's gone from 1 page to 3 pages. We'll have information at a quick glance. We don't have to flip through the whole chart, look through nursing notes and everything else to see what other disciplines have written and the progress that they've made on a discharge.
Until we try it, we don't know for sure if it's going to do everything we need it to do. So just so you guys know, it's not written in stone. It's we're going to try it out first, and your feedback is going to matter, and we'll be asking for that feedback.
Everything with RTC is a trial. We try it, maybe it works, maybe it doesn't, maybe we need to make some alterations, but hopefully it will just be better for the unit and be better for all of us. More job satisfaction, more patient and family satisfaction. In the future, part of releasing time to care involves patient and family-centered care, and we can explore and will explore the possibility of inviting patients and their families to our board meetings so that they get a better understanding of what releasing time to care is all about, and so they maybe can have an understanding of why we are doing the things that we are doing.
Kudos to the whole team. I think it's been almost a year since I started doing the pyramid visits, and the one thing that I have been really consistently impressed with is despite all the challenges that you faced on the unit, just your patience and perseverance in releasing time to care initiative. That continued willingness to test changes and find out what's working, what's not working, to contribute your ideas into making the unit better. I know that in days to come, if you keep on the path that you're on, that you are going to be very successful in improving not only the workplace, but probably most importantly, the patient and family journey when they're with us. So yeah, just kudos to each and every one of you for that day-to-day commitment you bring to the workplace.
All right, I'd like to thank everyone for coming, thank our guests for showing up to the board meeting, and they can sign their pyramid visit. And yeah, I'd like to thank everybody for coming. Thank you for volunteering to take pictures, and continue on with the rest of your day, ladies. Thank you.
Good work, guys.
Thank you, Charlene.
Spectacular. Good job.